Hello, I'm Deja Breedlove for the Power of the Patient Project, and my guest today is Jack Pocorobba. Hopefully, I said that right.
Pocorobba.
Uh,
Close enough.
Pocorobba, okay. Group president at Surgical Care Affiliates in South Jersey. Now, Jack has held the position for over 2 years. Prior to that, he was a group vice president of operations, and prior to that, was regional vice president of operations. And he has been with the company for over 12 years. Prior to joining Surgical Care Affiliates, Jack was executive director of Golding Living Senior Living in Bucks County, Pennsylvania. Jack has also earned his MBA in Healthcare Administration from Holy Family University in Philadelphia, and his undergraduate degree was in Healthcare Administration from Arcadia University in Glenside, Pennsylvania. So he's very accomplished. He also is a certified. He's certified as a surgery center administrator. So today, Jack is going to discuss why surgical centers are so important to patient care and how patients can have the best experience when they require outpatient surgery. So thank you, Jack, so much for joining us today. We really
Of course.
appreciate having you here.
Happy to be here.
Awesome. Okay, so first, Jack, tell us about your career journey so far and how you became a part of the surgical care affiliates.
Sure. So I am someone who I guess you could say aspired to be a leader in healthcare probably all my life. As you noted, I started in long-term care and grew up in a family with a grandfather who had Alzheimer's and progressed through the disease very, very slowly. And as a close-knit family, we spent a lot of time in the assisted livings and then ultimately the nursing homes he was in, and moved him around quite a bit due to some poor care that he received. And that was going on right around when I was in high school and really into college. I found myself getting jobs in the facilities he was in just to be close to him, whether it was an activities aide or a personal care aide. And then as I got into college at Arcadia, decided that I was going to try to go into what they called an executive director in training program. And so spent the year after school in that program becoming licensed to be a skilled nursing facility administrator. And by the age of 24, had the luck, so to speak, of getting an opportunity right away as soon as I was licensed. And so spent some time in Harrisburg running a small facility, then came back to Doylestown, PA, and ran a larger facility. And so for about 5 years, I was with Golden Living, running skilled nursing facilities, and was doing fairly well professionally. I'd gotten to the point where, however, I was looking for something else, but I was the type of individual who that passion and drive to do what was right for my grandfather was still very much a part of who I was every day and how I grew up. And so it was important to me that I found the next opportunity really, although it might not be exact, could still fill that void for me. I'm a strong believer in where your professional passion can cross through your personal passion. It's a pretty powerful place as a professional. And so I spent about a year and a half looking for the right opportunity, and surgical care affiliates came my way eventually. And really what we are doing in the surgery center space is kind of the same but different in what I was looking to do in long-term care. We like to say we're improving healthcare in America by reducing the cost curve, which, as many people know, in the United States, we have one of the largest GDP per capita spend of any kind of country nationally, and so or worldwide. And so found this opportunity to run a surgery center that was improving the cost of care in, to your point, Mount Laurel, New Jersey. And so took that on, was there for 3 years, and ultimately got my first promotion, and since have been able to grow within this organization to where I'm now responsible for 50 surgery centers that we have in the Northeast, from Maine down to Virginia.
Oh, wow. That is amazing. Wow.
It's been a great journey.
You're doing. Yeah. Awesome. Okay. So my next question is, what are some of the reasons a patient is referred to an ambulatory surgery center? And typically, what kind of procedures are actually performed there?
Yeah, the way I like to explain it is a freestanding ambulatory surgery center can do the exact same cases that a hospital outpatient department can. It is
Mm-hmm.
literally any type of procedure that you can go in for and go home the same day.
Oh,
Uh,
okay.
that's ultimately what we're doing. And so those can be things as simple as colonoscopies, cataract procedures, very low acuity stuff um, under even local anesthetic. And then we
Mm-hmm.
have more higher acuity stuff that over time continues to be migrated to an outpatient site, like total joint procedures. There's some cardiac below the knee procedures that are starting to happen in ambulatory surgery centers. But
Mm-hmm.
really, it is anything that you can come in and go home the same day for. In
Oh,
terms of what would be referred to an ASC versus maybe a hospital setting, it's
yeah.
really provider preference. There's no difference in the procedure. A lot of times the specialist will have certain arrangements that they'll be disclosing to the patient. And so that may require them to go to an ASC, but there's no clinical difference in terms of what a patient might require in an ASC versus a hospital outpatient department. Now, overnight stays are very different. And so
Mm-hmm.
what I like to say is more acute procedures that will require a longer stay. They're not for us, and we're not trying to do that.
Mm-hmm.
So that's something that you would still find yourself in a hospital, normal kind of wing, so to speak, for overnight.
Awesome. So you would say, so basically going to an ambulatory surgery center is for like same day procedures to where it's not like
That's
an
it.
overnight thing.
Yeah, anything you'd be discharged the same day is
Mhm.
a potential ambulatory surgery center or ASC procedure, as we say.
Awesome. And I do believe you said also one of the differences is a little bit more cost effective, right?
That's right. So I always say what's really cool about what I do is when I wake up in the morning and go to work, I'm
Mm-hmm.
improving the cost of healthcare in America. And sometimes when people hear that, some people can jump to like, well, does that mean you're doing it cheaper, quote unquote? No, this is the cost in terms of the patient. So the best way to think about it is if you're at a hospital outpatient department, the only difference between that and an ASC is the reimbursement that each setting is getting, the money they're getting for
Mm-hmm.
doing the procedure. So, and at a hospital outpatient department, they're actually making upwards of $200, $300, $400 more, which in turn, 20% of that is passed on to the patient as either a copay, co-insurance, or a deductible. And so ultimately what's occurring is, let's use a simple example like a colonoscopy.
Mm-hmm.
People colonoscopy at a hospital outpatient department, or even in a hospital inpatient setting, which is still, believe it or not, happening in a lot of places, that case might be billed out for $1,200. If you do it in an ambulatory surgery center, it's being billed out for $800. And you
Oh,
could have the same doctors, you could have the same staff, the same time, and the same clinical outcome. The dollar amount will still be, a $400 delta, of which the patient pays 20%. And so ultimately, an ambulatory surgery center with the same clinical outcome and the same staffing arrangement, the same cost for the procedure, for expenses, labor, clinical staff, is actually going to be $400 less at a surgery center. It's the way
oh,
our current reimbursement structure nationally is set up. It's one of the things that, if you think about it, doesn't really make a whole lot of sense, but it's the way it's established today.
awesome. And before I go into my next question, really quick, I want to ask you now, as far as it being more cost effective, that is not just in Jersey. That is anywhere that you guys
Yeah.
have a surgical center, correct?
That's right. That's nationally. So
Wow.
the way it's a great question. The way it's established is the Centers for Medicare, Medicaid, so CMS will establish the dollar amount per ambulatory surgery center approved procedure. So that's also an important piece. We're not doing any surgeries that federally haven't been approved. So federally, nationally, all of these procedures have been approved to be done in an ambulatory surgery center. And so we go off of that, and then they set the dollar amount, and really they set that $400 delta in my example as well.
Mhm.
There's a small difference by geography. So New York City, maybe $20, $25 more than somewhere in Oklahoma per se.
Yeah.
But that's really only the difference. It's nominal based on the geographic location. Yeah.
Okay. Thank you for that information. Okay, so my next question is, if a person is to have a procedure done at the surgery center, what can they expect from the moment they arrive until when they're discharged?
Yeah, I mean, you can really expect the same thing as you would for any type of hospital-based procedure.
Mhm.
The only difference, and I say this jokingly, but also sort of serious, is that in the ambulatory surgery center, it's probably going to be more efficient. Like you're more likely to start on time. You're more
Yeah.
likely to not have any issues, because when you go to a hospital, the risk is that anesthesia is not ready. There's a trauma case that comes along.
Hmm.
Something bigger within this hospital system could derail. And I hear stories of this all the time.
Hmm.
Um, so in an ASC, you're more likely to have an ambulatory surgery center. The case start on time. Nothing's going to get in the way of that. You can expect a call from a pre-admission nurse that kind of walks you through all the day of surgery expectations. If you're having a colonoscopy, or really any type of procedure that's requiring anesthesia, the same as a hospital, it'll be kind of don't eat anything. The only thing you can drink is clear liquids after midnight. Um, but other than that, it's a pretty simple kind of expectation. You should get a call with the expectation around any type of copay or deductible that might be due at the time. But other than that, I think that should be about it, really.
Awesome. So you would say, like, overall, you guys give the patient actually more personal care versus like a hospital where, like, things don't start on time and you're kind of just like a number versus like, it's more, you get more attention, would you say, like in the surgery center?
Yeah, I mean, we're incentivized ultimately to create a really good experience. And when I say it's more efficient, that doesn't mean anyone's cutting costs or trying to rush people out. That
Yeah.
there's no propensity for us to be slowed down by outside things where a hospital may be more likely, right?
Hmm.
If you're at a large hospital system and again, there's a trauma event, you're going to get bumped a little bit for your cataract or colonoscopy or whatever it may be. That's just a reality because you're not an urgent procedure. You're more of an elective procedure. And so at the ASC, you don't have to worry about that. And so when you get there, we're ready for you. We're moving you along per the schedule,
Hmm.
and really discharging you as soon as you're good to go. So for sure, it's very much a more personable experience, no doubt.
Awesome. That's amazing. Okay, so my next question is, many older patients remember needing to go to a hospital overnight whenever they're required a procedure. So aside from the cost, what other medical advances have allowed providers to do these procedures in an ambulatory setting where a patient comes into the facility and leaves the same day?
Yeah, I mean, at the end of the day, what's most important when you're thinking about, hey, if I'm not at a hospital, what are my risks as a patient? It's
Hmm.
really looking at clinical outcomes, right? And so at the end of the day for us, what you see is in an ambulatory site, and there's a lot of data on this nationally, there's less risk of an infection,
Mm.
significantly less, almost no risk whatsoever in some instances. There's less risk for a medication event or for a need for any type of unexpected intervention.
Mm.
And so a lot of what we do in our world is analyze that constantly, look for opportunities and trends. But what you'd find is the negative outcomes or adverse events, as we like to call them in the surgery center space, are actually significantly less than in a hospital. Now, why is that? Perhaps just you have the oversight of a hospital and can make a quick transfer. But in our world, we don't see it. And we're constantly monitoring it because at the end of the day, we don't want to be looked at as this efficient area that is just trying to turn people in and out, because that's not who we are. At the end of the day, taking care of patients is really our priority. And so when you ask the question directly around what type of medical advances, I don't know if there's medical advances. We literally are creating the same environment that you would see at a hospital. The only difference is you don't have access to an overnight bed. And in the case where something might occur, which happens, very rarely, all of our ambulatory surgery centers have transfer agreements with local hospitals and a partnership. So that way the patient can be taken seamlessly to the hospital if it's needed, and be seen by the same physician and rounded appropriately if necessary.
Awesome. That's amazing. Okay. Now, thank you for that information. Now, my last question, finally, what are some of the future advancements in ambulatory surgery that patients can look forward to in the next couple of years?
Yeah, I mean, we see more and more, honestly, more and more clinically complex procedures happening, or getting approved, I should say, federally to occur in an ambulatory surgery center. And so if we were having this conversation 10, 12, 15 years ago, total joint, total knee replacement procedures were not occurring. Today they are, and they're approved, and the outcomes are just as strong as anything else. Like I said at the start, we're seeing more and more cardiology procedures actually be approved, and be accepted. And again, this is all outcomes monitored, and so positive, strong outcomes similar to that you would see in a hospital are occurring. Again, now more of what I like to say is the cardiology procedures that you're seeing approved nationally are below the waist procedures. So catheterizations, where a wire may be taken into the heart and monitored on a screen, but they're not invasive, where there's a surgical procedure that's actually happened at the heart. We see more and more invasive spine procedures happening.
Nice.
And that's really where technology is advancing for these types of procedures. But I say that, going back to your previous question, not so much where it's just for the ASC. These technology advancements have occurred in the hospital, and because they're seeing more and more patients go home in a hospital setting on the same day, they start to then open them up to the ASC space as well. And so really those are the three, I'm trying to think, those are the three main areas. It's really orthopedics, cardiology, and neurospine that we're seeing more and more migration into our space. And with that, we're really getting, again, the benefit of what we talked about at the top, which is significant cost savings to the patient for, ultimately was the same outcome in a hospital location to an ambulatory setting.
Wow, that's amazing. Well, that is definitely something to check out. And thank you so much, Jack, for joining us and sharing all this valuable information with us today. And I'm Deja Breedlove for the Power of the Patient Project, the National Library of Patient Rights and Advocacy. Thanks for joining us, and we will see you next time.
Awesome.
Thanks.